Welcome, everybody. On behalf of Health Advocate X, we are excited that you are joining us for our second X Center series titled Trauma Informed Care. In this session, we are going to be talking about trauma from the survivor perspective and looking at how trauma informed care can support individuals and family members. And we're joined today with Lee Frost. So, welcome, Lee. We're so excited to have you. In today's session, our learning objectives are going to include, first and foremost, differentiating between the impact of short and chronic trauma. Then we're going to assess and apply the window of tolerance to situations with individuals. And then we're going to define and provide some examples of how we use Glimmers to help people with trauma who are seeking care. So again, Lee, thank you so much for this amazing talk that you're going to give. I'm excited to hear what you have to say. Take it away.
Thank you. I'm really honored to be here. I've been working in digital strategy in healthcare for the past 10 years. That means I've been working on things like content strategy, social media, and analytics. I was diagnosed with complex post-traumatic stress disorder at the age of 51, and I used my background in science writing to help me understand all the aspects of CPTSD and share my experience with others to offer support and education. After learning about how CPTSD is linked with chronic medical problems, I wanted to help medical professionals understand the connection. I advocate for the widespread use of trauma-informed care because people with chronic illnesses as well and their caregivers often experience trauma, but it often goes unaddressed. There are long waits for diagnoses, there are misdiagnoses, and all the things that people struggle with in our healthcare system. So to begin, we'll take an overview of complex trauma itself. So for some basic definitions, post-traumatic stress disorder is a mental condition that develops in reaction to physical injury or severe or mental or emotional distress, such as military combat, assault, natural disaster, chronic illness, or other traumatic event. And complex post-traumatic stress disorder is the result of chronic long-term trauma, such as childhood abuse or neglect, domestic violence, trafficking, or war. To dive a bit deeper into the difference between the two, PTSD is the result of short-term trauma, and it was added to the DSM in 1980. CPTSD is the result of sustained long-term trauma over the course of years. It's recognized internationally and is on the ICD-11, but it is not on the current DSM in the United States. Methods of diagnosis vary, but the Adverse Childhood Experience Test is a key indicator. The ACE test was developed by Dr. Vincent Folletti and Dr. Robert Anda in the 1990s. It's a 10-question survey that asks about the types of abuse, neglect, and household dysfunction in someone's childhood. And that result can point to complex trauma, as well as the risk for developing health problems later in life. CPTSD is also differentiated by additional characteristics, such as chronic medical problems, emotional dysregulation, a diminished sense of self, and relational issues. It's often misdiagnosed as borderline personality disorder or bipolar. And CPTSD and ADHD are kind of considered a package deal because ADHD is thought to be part of hypervigilance in this case because we're distracted and having trouble staying focused and organized. And trauma itself is considered acquired neurodivergence. So to explain a bit further, on the left here, we have the core symptoms of PTSD. This is hypervigilance, avoidance, and flashbacks. In addition, CPTSD experiences that difficulty of regulating emotions, feelings of shame or guilt, and trouble in staying in relationships. And when I refer to relationships, I mean all types. Romantic, friends, family, coworkers, any and all relationships have challenges with complex trauma. This is in part due to the fact that people with CPTSD tend to have trouble identifying and expressing their emotions and don't feel safe to do so. And a word about flashbacks. They're not as clear cut and vivid as they are when portrayed in movies or TV shows, especially when it comes to CPTSD. Because there are many layers and many years of trauma and abuse, triggers can come from anywhere and be really subtle. We may not even know why they're happening or what specifically set the flashback in motion. It can be the scent of a cologne that reminds us of an abusive incident, but we aren't aware of exactly what that is. It can be anything like the way someone looks at you or a tone that they use when talking to you. They don't call it complex trauma for nothing. If you were raised in a chaotic environment, triggers may be everywhere. And these are some additional aspects of CPTSD. In addition, we have a tyrannical inner critic. This is an internal narrative that can be based on actual things that someone heard while growing up, like being told that we're useless or broken. And it becomes an ever present inner voice that criticizes us all the time. In one methodology of recovery, it's said that the inner critic is actually a fierce protector that is trying to protect you from harm. In any case, it takes a lot of work to tone that voice down. We also have a wounded inner child, social anxiety, hyperindependence, which means we often refuse to ask for help because it wasn't safe to do so in the past. And now we just can't even imagine asking for help. We also have a lot of trouble with sleep disorders, frequent nightmares, low quality sleep, and insomnia. And when you hear the term highly sensitive person, that can also be part of a trauma response as well. The Body Keeps Score by Bessel van der Kolk is one of the primary texts for understanding complex PTSD. And dissociation is the essence of trauma. The overwhelming experience is split off and fragmented so that emotions, sounds, images, thoughts, and physical sensations related to the trauma take on a life of their own. The sensory fragments of memory intrude into the present where they are literally relived. As long as the trauma is not resolved, the stress hormones the body secretes to protect itself keep circulating, and the defensive movements and emotional responses keep getting played out. While dissociation is a broad category that helps us understand what it is, the experience varies widely for every individual. One of the more common manifestations of this is depersonalization derealization disorder. Depersonalization is feeling that yourself is not real. It can also feel like you're observing yourself from an external point. And some trauma victims explain some of their experiences that way, that during the traumatic event itself, it felt like they were not in their own body, but they were watching it from another vantage point. Derealization is feeling that the world and the environment around you isn't real. And while this presents differently from person to person, it can look like feeling spaced out, not tracking conversations or what's going on around you, shifts in behavior and character, and retreating to inner worlds. And there's been some exciting new research about traumatic memories. This was a small study, but it was very informative. And it involved the brain scans of 28 people with PTSD. Sad, neutral, and traumatic memories were recorded and played back while people were being monitored by imaging equipment. And the sad memories were shown to engage the hippocampus, the part of the brain that recognizes and contextualizes memories. The hippocampus wasn't involved in recounting traumatic memories. Rather, the traumatic memories engaged the posterior cingulate cortex, which is involved in internally directed thought like introspection and daydreaming. The researcher explained that this isn't a state of memory, but it's a state of present experience. These traumatic memories were not experienced as memories, but as fragments of prior events that are taking over in the present moment. The research is exciting because most studies about trauma focus on the amygdala and the hippocampus, and this gives us more insight into more areas of the brain that are involved in memory process and overall function. Here we have the four F's and their respective characteristics. You may have heard of fight or flight, and this is by no means a comprehensive list of characteristics, but it's an overview to give you a picture of the patterns of behavior that are associated with each type. And so we have fight, which is angry and combative and bullying. Flight is being in a constant state of worry and anxiety and being very over busy and overworked. And freeze is preferring solitude, being dissociated, feeling overwhelmed, and feeling stuck or shut down. And fawn is a super caregiver. It's a total loss of self, people pleasing, avoiding conflict. They were often parentified children who had to take care of their parents' needs as very small children. And over time, are unable to connect with their own emotions. When it comes to the four F's, hybrid types are very common. And some of these characteristics can be contradictory depending on the situation the person is in, such as fawn, flight, fight, where the characteristics of a caregiver can merge with a bully. I'm most familiar with fight, flight, freeze, which is being stuck in a cycle of working to complete exhaustion and followed by collapse and shutdown. And with all of these hybrid types, one may be more dominant than the other, and they can shift over time in a person's, over the course of a person's lifetime. What we're ultimately talking about with CPTSD and the four F's and all of their combinations is a dysregulated nervous system. The vagus nerve is a cranial nerve that goes down and interacts with your internal organs. Think about what happens when you feel really stressed out. You have these symptoms because you're going into survival mode. Dry mouth, trouble breathing, changes in heart rate, changes in temperature, slowing metabolism and digestive problems. This all has to do with stress hormones that are moving throughout your system. For people living with complex trauma, we are living in survival mode all of the time, and it feels like it's never going to end. And as research has shown, being intensely stressed out all the time has consequences on our health, and I'll be talking about that in a bit. So here's an overview of the autonomic nervous system. There are two main branches. On the sympathetic nervous system side, this is where the fight or flight lives. It is a system of action. It's filled with chaotic energy, mobilized to attack, driven to escape, anxious and angry. On the other side, we have the parasympathetic nervous system. And the ventral vagal is where we aim to be. This is the system of connection, feeling connected and able to communicate, able to go with the flow and engage with life. And on the dorsal vagal side, this is the system of shutdown. This is feeling disconnected and dissociated and drained of energy and just going through the motions. The dorsal vagal system is often referred to as functional freeze or survival mode. And hypervigilance is part of neuroception. This is your internal surveillance system. To get a sense of neuroception, you drop into your body, you pay attention to what's happening inside, your heartbeat, your breathing rhythm, how you hold yourself, and whether there's tension in your muscles. It's noticing how you react to your environment. When in survival mode, the sympathetic nervous system activates the four F's, and the hypothalamic pituitary adrenal gland axis, also known as the HPA axis, releases the stress hormones. This is the basis for polyvagal theory and how we can tune into why we're being so reactive with CPTSD. The guard is in his tower, overloaded on coffee, and he's ringing the alarm bell all the time. Polyvagal theory teaches us to befriend our nervous systems and learn how to be more regulated, and it's a lot of work. I've been doing this for 3 years now, And I feel like I'm only just starting to integrate these practices into my life. And this makes sense. After spending a lifetime overwhelmed by CPTSD, the habits we develop are ingrained into every aspect of our lives, and it takes a lot of time and patience to reset the system. The goal is to expand the window of tolerance, which is the ventral vagal branch of the autonomic nervous system. In people with CPTSD, that middle ground of feeling safe and connected is small. Too hot is hyperarousal, which means we're feeling overwhelmed, sleepless, full of panicky and chaotic energy, and you simply cannot relax. In the too cold zone, which is hypoarousal, it's the opposite. It's where we feel numb and dissociated. It's a lack of emotion and a lack of energy. Some people spend too much time in the hot section, other people spend too much time in the cold section, and others vary wildly between the two. As an analogy, if you're familiar with diabetes, it can be similar to trying to keep blood sugar in range. It can fluctuate from being too high and too low with very little time in the range of regulation. And practices like somatic experiencing can teach people how to build capacity and broaden that window of tolerance so that they feel safer, more connected, and able to identify and manage their emotions and triggers with more precision. Being aware and understanding the biology of stress is an essential step in the process. And I'd argue that this is foundational understanding that should be part of the first line of treatment in people living with complex trauma. So, to connect with the present and learning to feel safe, we have grounding. This is anchoring back to earth and feeling like you're back in your own body. For people with PTSD or complex trauma, we are taught to use grounding as a means to cope with being triggered, and it often relates to the senses, what you can see and feel around you, and to drink something or eat something to help you feel more present in your own body. The next step is orienting. This is the process of regaining awareness of your surroundings and connecting with the environment around you. Resourcing is a toolkit for getting out of that dissociated or triggered set. Anything that shifts you toward a sense of well-being, safety, or environment. And I have some techniques to talk about this in a little bit. There are many ways to help break this cycle of catastrophizing. Rumination and worry magnifies into anxiety and results in hopelessness. These are some techniques that I learned through the Curable Groups program. The AIR technique, awareness, interruption, and replacement, this is learning how to change unhelpful patterns. First, it's awareness. What is the pattern? And identifying what needs to change. And it's helpful to notice this in the moment. What is happening? Are your shoulders up by your ears? And why? How to change this? It's positive just to even recognize it on its own, because over time, this helps rewire your brain to react more positively. You interrupt that negative moment when it happens and do something physical to break that cycle, replacing it with something to train your body. So, stretching, yoga, meditation, enjoying music, or whatever helps, redirecting the focus to feel empowered. And you start with one thing and you make incremental changes over time. And then you start to do this with other unhelpful patterns. Outcome independence is changing your level of success and being comfortable with shifting goals. It's learning to be okay no matter how the situation changes. You don't tie success to a set goal. You have to learn to be adaptable. You pace yourself, you accept setbacks, and don't view them as a failure. Rather than focusing on symptoms and capacity, you focus on the positive things. So, for example, here, if you went for a long walk, but you had to cut it short, what things did you enjoy along the way? Did you notice some nice flowers on the walk? Were you listening to an interesting podcast? Was there a nice sunset? And then there's graded exposure and pacing. And this can be very difficult for people with trauma. So it's important to find a baseline and work up from there and adjust as increments are needed. To find a baseline and work up from there, plan those increases and understanding where your safe zone is and don't do more than you planned for. You just have to be right under that threshold for being able to tolerate that activity. And these goals can just adjust as your capacity increases. This is all about visualizing success, a strong correlation between your actual life and imagining the success that you want to build for yourself. And this is part of neuroplasticity. Where the attention goes, neural firing flows, and the neural connection grows. This is a famous quote that's frequently found in the world of trauma from Dan Siegel at UCLA. And it's a good summary of how the brain sets pathways for reacting to environments and situations. This is all about neuroplasticity and the ability to change those pathways. Think about neural pathways as building up from dirt roads to highways. The more a neural pathway is used, the faster it goes. And the goal is to utilize pathways that aren't as built up so that they become more powerful and faster than the old roads that keep the trauma alive and thriving. So now we've come to part 2, tips for people who have trauma. It's chaotic in there. Ironically enough, I pulled this meme somewhere from social media long before I was diagnosed with CPTSD, and it speaks really well to how chaotic and fragmented the mind can feel. And all of that chaos has very real physical effects. This is a partial list of medical issues that have been linked to living with complex PTSD. And these came from the adverse childhood event experience test study that was done in the 1990s with Dr. Folletti and Dr. Anda. So you can develop asthma, autoimmune disorders, cardiovascular disorders, ME, and chronic fatigue syndrome, chronic pain, diabetes, a range of pelvic issues, in addition to digestive problems and migraines. Sometimes they're comorbid conditions that have been with you throughout life, and other times they can be completely random things that happen along the way that sometimes correlate with very stressful life events. I'd also like to highlight the reproductive issues that come with complex trauma. There is a strong correlation between severe physical and sexual abuse and gynecological problems. The connection is also dose related, meaning the chronic pain and symptoms correlate with the intensity of the abuse. In other words, the worse the abuse, the worse the condition and pain. Approximately 79% of childhood sexual abuse survivors develop endometriosis and other pelvic problems. Women who experience chronic pelvic pain are more likely to use dissociation as a coping mechanism. And perimenopause is also harder for people living with CPTSD. The symptoms are more intense. Chronic stress can lead to imbalances of estrogen over time. And as estrogen levels fluctuate and dip during perimenopause, the anxiety can worsen. This also involves the HPA axis, which is already dysregulated in CPTSD, and it becomes more dysregulated during perimenopause. It's also important to consider dysautonomia. This is a general term for disorders that disrupt the autonomic nervous system. It can range from mild to severe. It can develop at any time in life, but the average age of onset is between 50 and 60, and it affects more than 70 million people worldwide, and its prevalence has been increasing in recent years. And if you think back to that infographic about the vagus nerve, this makes sense because the nervous system interacts with the internal organs that are connected to these symptoms. So here are some recommendations. Take a holistic view of the person's medical history. A constellation of seemingly unrelated symptoms can form a picture of chronic stress and trauma. keep track of symptoms and identify patterns. There are a ton of apps out there that help with symptom tracking, but if you're not comfortable keeping track of these things in a digital space, use a notebook and bring these notes and questions to your medical appointments to fill in important context that may otherwise be forgotten, because medical appointments can be stressful. Shutdowns can happen, and going nonverbal comes easily to people living with CPTSD. And here we are in part 3, tips for advocacy. There should be no gatekeeping in trauma. From the perspective of the autonomic nervous system, there is no big T or little t trauma. The nervous system is stuck in functional freeze and survival mode, regardless of the cause. You may hear people say things like, I didn't have it as bad as other people, or you didn't have it as bad as other people. And complex trauma is not always caused by physical abuse. Long-term sustained emotional abuse can result in CPTSD as well, and generational trauma can be passed on. We also need to consider the broader influences, socioeconomic environments, and the communities that people are from. Health equity is a huge factor here, and we need to listen to people's experiences, acknowledge them, and help them establish support and trust. Promote predictability and consistency. In general, people with CPTSD don't like surprises. Expectations and guardrails should be set in the beginning, and provide a content warning when approaching difficult topics. And if it's a medical procedure, describe it in detail. And it's okay if someone feels reluctant to participate in conversations. Memories may be missing because the brain didn't record them at the time of trauma, or because they were so young it's difficult for them to describe. There are a lot of reasons for these shutdowns, and they can happen at any time. This is also known as islands of competence, and it comes from the ADHD community. And what we're talking about here is creating a support system to empower people living with CPTSD. People with CPTSD have this harsh inner critic. So to try to focus on building self-esteem, to change the narratives that the inner critic produces, changing that narrative is key in neuroplasticity and rewiring the brain to find a more positive outlook, to get out of that trap of rumination and catastrophizing. What this looks like in practice is leading with something positive before venturing into any kind of constructive criticism, highlighting the strengths of a situation or the person as much as possible, asking open-ended questions to help them think things through without the shadow of perceived judgment over them, and helping people identify their strengths and build upon them. Once they start gaining confidence, it helps to grow in other areas of their life, and it helps with building skills like problem solving. This is a great graphic that I got from LinkedIn. While not all introverts have complex trauma, people with CPTSD tend to be introverts. So I would advise not to force interaction. People living in functional freeze rarely, if ever, feel safe. So calling them out for not participating can bring about feelings of shame, and the inner critic lives for these moments. Give people space and time to gain trust, check in and listen, but people who are quiet and introverted have a lot to offer. They are insightful, nurturing, thoughtful, reflective, visionary, and can be very deep thinkers and focused workers and effective leaders and empathetic. There's a lot of great stuff in this graphic. I could just keep talking about it. But this is definitely one to pay close attention to. Glimmers are used in therapy and recovery programs for trauma. Glimmers are the opposite of triggers. These are small positive moments that help break the cycle of chronic fear and anxiety and help to rewire the brain to have a healthier outlook. It establishes a habit that is more accessible than waiting for the big achievements. And it's important to note them whenever you can, to write them down or share them with a friend, or if there's a group that you can share glimmers with as often as you can. And the smaller the glimmer, the better it is, because this is constantly training your brain to build those new neural pathways. And some examples can include those moments where you just realize how cozy and comfortable you're feeling in bed, or you're walking the dog and you see a beautiful sunset, or you're enjoying your favorite cup of tea. Whatever it may be, these are really important to identify and record whenever they happen. Anchors are a recommendation that come from a book called Coping with Trauma-Related Dissociation by Suzette Boone and Kathy Steele. Identify and use these things that are neutral and pleasing to experience. They're often sensory related, and these can be placed throughout the house. These are things that you can carry with you, and you can identify them and just keep going back to them. These are things that can be source of comfort. A resource is anything that helps soothe and settle you. It provides a sense of goodness and is used to help anchor us in the here and now. It prevents that downward spiraling of emotions and memories that can impede the healing process. And there are both internal and external resources. How we experience our somatic self will determine how we can internally resource ourselves. For example, think of a child carrying a doll. This is an external resource. And over time, that external resource becomes internal, that sense of comfort that you can just summon for yourself. The key is whether or not you can tap into that internal quality without the external over time, that the doll is no longer with you. But on the other hand, always resourcing can get in the way of healing. So it's just about establishing that balance, and that over reliance may happen initially, but eventually it starts to drop away as you start to build capacity. And that is an essential step in the healing process so that old trauma can be released and you develop the ability to be more regulated and resilient. Identifying resources. So this is a good writing exercise. Write down as many as you can and identify whether they are internal or external. An instinct may be able to draw you to some of these. You may have been grabbing your favorite hoodie without realizing that you were resourcing. This falls into neuroplasticity and training your nervous system to feel safe, calm, and collected. And it's interesting to start with the resources you may have had as a child and how they changed over time. And were you able to bring any of those into yourself as internal resources? But it's always okay to have an external resource no matter where you are in life or what the situation is. And here is a list of books to understand complex trauma more fully. From Surviving to Thriving by Pete Walker is an excellent primer on complex PTSD. He himself has CPTSD, and he's a therapist, and he does a lot of case studies about his patients. It's a short read and is incredibly detailed and informative. Coping with Trauma-Related Dissociation, Healing the Fragmented Selves, and No Bad Parts, Internal Family Systems are all excellent resources for dissociation. Internal family systems is a methodology used by some therapists to help people explore how their inner narrative has become fragmented due to trauma. And it offers a range of exercises to help overcome that fragmentation and anxiety. Bessel van der Kolk's Body Keeps Score and Trauma and Recovery by Judith Lois Herman are both excellent deep dives into complex trauma and all the different medical problems that can result from it. Anchored is foundational knowledge for about polyvagal theory and somatic therapy and learning about the autonomic nervous system. She studied with Stephen Porges, who is the founder of polyvagal theory. And his books, he has very complex, large textbooks about all of this. And if I were to recommend only one book on this list, it would be The Myth of Normal by Gabor Mate. He's an expert on trauma, stress, and addiction, and how generational trauma manifests in society at large. He was born in Hungary during World War II and personally experienced trauma that led him to pursue becoming a physician to focus on these issues. He's an amazing speaker, and you can see a ton of videos with him on YouTube and elsewhere, and I cannot recommend his work highly enough. So that brings me to the end of my presentation. Thank you very much for being here and for listening.
Thank you so much for that talk. I really appreciate it. And I know our audience is going to take so much from this. I have a bunch of notes and some questions, if you don't mind having a little bit of discussion. Um,
Sure.
I will say that so much of this resonated with me because I too am a trauma survivor. And a lot of this starts with like, oh gosh, I don't even know where to begin. There's so many points of this where you talk about the neuroplasticity and just changing that narrative and how incredibly important changing that is. And one of the things that you mentioned with the glimmers, so we'll just start with the glimmers because I think that is probably one of the simplest things to start with. If you can just start with when you're in those moments, look for something that can be grounding, something that is that comfy moment, my favorite coffee, having those times with my dogs. And I think that probably was one of the first ways that I started going through my trauma is focusing on the positive, rewriting some of those narratives. Can you talk a little bit more, if you don't mind, about your glimmers or maybe some of your recent glimmers?
It's so funny. When I first learned about glimmers, my eyes rolled so hard. And but then it was like, I was in these like therapy sessions where we kept talking about it. And it was a group therapy session where every time we'd go around and everyone would share a glimmer. And I was just struggling with it because I kept trying to go for those big achievements, something big that happened at work. But we had recently adopted a dog, and he was very nervous about being in a new environment because he was an older dog who, he was used to his family, and now he finds himself across the country with us. And we're going for a walk together, and there was just this spectacular sunset.
Mhm.
And it really sunk in for me. It was like, oh, this is a glimmer. And that started the habit. And I now have an app where I get to record them, and I try to record them every day. I do my best, but I do that as often as possible now. It's that favorite cup of tea. It's that favorite song that just makes me want to move and take up space.
I love that. I've never thought about writing them down and like keeping a record of them, but I have started making it a practice that every day, whether it's at the beginning of the day or at the end of day, on the best days I do it both, that I start with what I'm grateful for. And I hard rolled my eyes. I'm very cynical sometimes. When this was first brought up to me, I was like, well, you need to start looking at the good things. I'm like, good things. But I did notice a huge difference when I started really focusing on gratitude. And a lot of what you're talking about is coming back to the present moment. And whether it is, grounding with where your body is, what your body is feeling in that moment. And a lot of some of the work that I've done and the readings that I've done really talk about as you mentioned, we have to refocus our nervous system because when we are too high or too low, our nervous system is just off. So if we take those breaths, do you want to say any more about ways that you regulate your nervous system in those moments? What are some of the tips that work for you?
But one of the key things that I learned about myself as I started doing this work is that I've always been breathing very shallow and I tend to hold my breath a lot to the point where I've even fainted a few times, which feels really ridiculous. Like you wake up on the floor because you actually held your breath to that point. So learning how to breathe from the belly has been an amazing experience. And it was strange at first because it was incredibly triggering when I started doing somatic therapy. And I could barely get into, you don't even move. You're just lying there and just like listening. What is my body telling me at this point? And it was too scary. And 3 years later, it's now becoming much more natural. My shoulders are not living up by my ears all the time now because, like, over time, it's like, okay, my nervous system thinks that this is really scary, but there's nothing happening. There's like, I'm not even having an upsetting work day. It's just my nervous system's just trying to like keep me in that cabinet I used to hide in as a child. And it's so liberating to finally be able to emerge from that space and just be.
Mhm.
But it takes a lot of time and practice. But, you know, like every day I do a little bit. It may be just like 10 to 15 minutes of focused exercises, or it might be a whole half hour to an hour of just dancing however I want to, whatever my favorite music is. And it's a lovely experience. And over time, that helps you just become more relaxed overall. For example, I used to be terrified of giving any kind of talk or being in front of people. And here I am giving a presentation, and I feel really cool about it. So
As you
that's,
should. This is
that's
so great. I love you mentioned the hiding in a cabinet. I hid behind couches. So that was where I would go and hide. If things got to be too much, I'd go and I'd grab my book and I'd hide behind couches. And as an adult, I feel that withdrawal when things get to be too much. If my again with that window of tolerance, I cannot tell you when I first heard about that broke all the windows in my world because it was like, that's what's happening, that range. And once I had that language, and I really hope that that image helps our audience in thinking about trauma and the ways that our emotions go up and down. And when you go too high, just like with diabetes, you spike too high and on everything starts to fall apart, or you go too low. And what's so important that I want to make sure we emphasize is that while your window might be like this right now as a trauma survivor or somebody experiencing trauma in the moment, it's going to shorten. But with time, as you said, with neuroplasticity, with learning these skills and these techniques, we get to open up that window and then
yep.
it makes it easier to stay in that range. But recognizing what's happening in our body at those moments, so much of this I think is really going to be helpful for survivors themselves, trauma experiences themselves, but also for advocates. So what might be some things you cover a lot here, so it's okay. But what are some tips for advocates that you might have if they're working with somebody going through trauma and maybe they're seeing that window closing down or they're seeing those things go too high or too low? What might we do to help them before they go too high or before it gets too low?
To hold space for somebody and to understand that this is never a linear process. Like just because you might start to open that window of tolerance, it might fluctuate over time. And so it's, you know, to work with somebody, and if they start to feel, you can start to see them feel a little anxious, to just give them that space. And, you know, not like, you know, these like couples arguments where like, why don't you just relax? Like just to allow people to take a step back and just say, look, it's, you know, it's okay if you need a moment. You know, take all the time you need, say what you need to say, and just help people free themselves from that trap that is keeping them
Mhm.
in that little space.
Yeah. And recognizing that that's what they're doing, I think,
Yeah.
right? And
I
we,
mean, once I started understanding the biology of stress, that was like the key thing because if I got triggered And even to this day, like if something like really like sends me into a meltdown, if I can talk my way through physically what's happening biologically, okay, my HPA axis is like a little out of sync right now. My heart rate variability is like way too high right now.
Yep.
What do I need to do? Breathe, calm, and it's like I can talk my way through it. I said, okay, this is just my body reacting. And that in itself helped me mentally so much overcome so much of this.
Absolutely.
But I'm a
Absolutely.
big science nerd, so I love to do the research on it. And so that's my coping mechanism is running to research and science.
I found my people. I'm the same way. That really, I'm a huge cognitive science nerd. So once I figured out what was happening in my brain, I went, oh, okay. So I talk myself down the same way. And for those that are watching this that are not cognitive science nerds like us, things that I have done with my clients include just what do you know to be real right now? So I'm sitting in my living room, I'm having a great conversation. I am, I have my favorite cup of tea next to me. What are things that I know to be real that isn't my fear or anxiety or that guard warning me of things because anxiety is a gigantic liar and if I listen to my anxiety, then I'm going to spiral. But if I can bring myself back to that present moment and just realize there is a table in front of me, and those basic things, and I can start coming down and getting my breath regulated and all of those other things are a lot easier to do. And I love the image of the guard tower. I love that that imagery of that guard is constantly on guard and he sees, I imagine, the tree shifting a little bit. It's like, there's a tree. And that's kind of how it feels internally. There's like, no, it's a tree. It's okay. Calm down. But when we're in it, every little thing can be setting us off. And so we do have that constant moment. So we have to learn to trust and we have to be able to have that space and recognize. And one of the other things that you point out is, again, with the narratives, that it is typically that very negative narrative because it's trying to protect us so much. Any tips for how we can help people rewrite those narratives from that negative initial draft to something that's more positive?
Oh, I feel like this is a tough one because I'm a Gen Xer and we were just so cynical from the very beginning. So it's like, how do you change that narrative? You have to get past the eye rolling and find what makes you truly happy that doesn't have anything to do with that, that's not based in negativity. And that is such a mess to untangle. So this, I think, goes back to resourcing and what kind of things are you using for self-soothing and journaling and just like trying to untangle this whole mess in your head. Like, and as you identify these resources, why is this a resource? Is it associated with a positive memory? Or, like what kind of these little glimmers can you bring into your life and acknowledge them and give them space and change your your story over time. And this was another aspect of somatic therapy. There was a movement class that went along with it. And the first time I saw the guy and he was like being really silly and rolling all over the place. And I was like, no, wait, I'm not doing that. And now I can't wait to do those exercises. Like that's like one of my favorite parts of the day is being as ridiculous as possible. So it's a process, but I'm also 3 years into this healing journey, so it takes a lot of time and patience, and these processes are going to look different for everyone depending on what happened to them that brought them into that space.
That is key, right? This is a journey. It is a process. It's not going to work for everybody. We're often going to be met with lots of eye rolls if we're trying to suggest this to a patient or a client that we're working with.
Yeah.
I've this so many times, and I too am a genetics, so I'm cynical to the heart. I'm like, this is stupid. And then I try, I'm like, oh, I guess it's not as stupid. And then you're right. Like, this is amazing. I love it. I dance it out all the time. And there's nothing like getting your body moving. And again, it go back to the cognitive science stuff, like why the body movement helps with that. But that's a, an X center for another day. But
Sure.
giving giving people that space to eye roll, to just try it. And if you hate it, great. We got lists of other things that we can
Yeah.
do. And just allowing people to love it or hate it. I know some people hate writing things down and journaling is stupid, or dancing it out and acting like a tree is stupid. But for once you try it, it might it might work. It might do something great. So allowing people to kind of continue to practice and play.
Yeah. And realize that that comes from the inner critic. The inner critic doesn't feel safe watching you do that kind of thing. So it's not necessarily you, it's that fierce protector saying, no, no, you're not safe to even do that kind of thing. So you might eye roll and hate it at first. You might come to enjoy it later, or you might find an alternate method that works best for you.
That's a really good point. I hadn't really thought about it, but and I'm thinking as an advocate, one thing I can do when I'm working with someone and they have that moment of like, no, I can't do that. I would be so silly, is maybe a really good question is, so what would be the worst that could happen? Like,
Yeah.
let's just take a second. So you dance it out and we look super silly. Well, I'm one of those people that I'm going to dance it out with you. I'm not going to ask you to do something that I'm not willing to go do with you. So we're going to look really silly together. Will that help if we're not just doing this alone and we have someone to be silly with? So maybe asking some of those questions to, I mean, kind of make our inner critic shut up a little bit, but maybe push back. And that's whether us challenging that inner critic, like, okay, well, so would I look silly for 5 minutes?
Yeah.
What's the worst that's going to happen? I'm going to look silly, but, kind of tease that out, I guess, a little bit.
Yeah, and on the other hand, you'll make your inner child really happy because they get to do things that they didn't get to do before.
Yes. And once you make the inner child happy, the rest of you gets really happy.
Exactly. You just have to find that joy.
Yeah. And that's so key. What other last tips, advice do you have for our audience today?
There are a ton of resources out there, and I would say approach most of them with a grain of salt because the wellness industry is some like $1 trillion industry right now, and there are lots of ads promising you a quick cure for something that you've been living with for potentially decades. So be open-minded to all the resources that are out there, but definitely do your research, ask a lot of questions, and think about whether what they're promising you is too good to be true, because anyone who tells you it's a quick fix is not telling you the truth. And someone who tells you that this is a process that takes a long time and it has its ups and downs is a much more reliable source.
Absolutely. But if we do the work, it
Mm-hmm.
can be a journey that we reach a better, I don't want to send end to, because I don't think there's ever truly like a fix and then poof, you are
Right.
magically forever, you're a survivor. But you
Yes.
can get to a point where you can feel like a survivor. And even though things might re-come up, you're able to manage that better. So
Yeah.
thank you so much for all of this that you are sharing with us. I greatly appreciate it. And we look forward to continuing to work with you in the future. So thank you so much.
Thank you very much for having me. I really enjoyed being part of this.
Thank you. All right.